2 years since COVID-19 was declared a pandemic. Over 6 million people worldwide have died from the virus since. In South Africa alone, though, the virus has claimed almost 100,000 lives. And joining us now to reflect on 2 years of COVID is the President of the Medical Research Council, Professor Glenda Gray. Prof, thank you for your time. Good morning to you. Let's look back, not a good sight just in terms of those who've unfortunately lost, but in your view, how far do you think the country has come?
I think we've learned a lot in the last 2 years, and when we went into the state of emergency and we had this pandemic, we didn't know what to expect, and so we followed the guidance of a lot of people, and in some ways that was good, and in some ways that was bad. And so I do think the hard lockdowns were incredibly hard on the economy and very hard on mental health and on school children.
You've spoken about the lessons that can be learned from the past 2 years. Where in these 2 years as the medical fraternity do you concede and say, we've made our mistakes, we've learned a lot from these mistakes, we could have done better?
I think that on hindsight's always 2020, but the most important thing was the discovery that vaccines work, and the massive rollout of vaccines at a global level, even though the initiation of our vaccine rollout was slow. In the end, the vaccines came, and our job now is to make sure we increase coverage. So I think that was important. I think not keeping children at school and being hesitant to return children to the classroom was a mistake. And I think that if we ever learn something again, is that education is critical for children, and them being in the classroom was the most important thing we could have done.
Yeah, and yesterday I had a conversation with Professor Shabir Mahdi about the national state of disaster, obviously the eNCC meeting yesterday. One of the things he was critical of was some of the decisions taken by the eNCC that were not necessarily scientifically based. I mean, why do you think that was the case, especially when the whole country keeps hearing from, the authorities, our leadership saying all their decisions are based on science? Where could we have done better there?
I think that I think that the eNCC obviously had a lot of stakeholders that they were engaging with, and one of them was the scientists. And so I guess the opinion of the scientists had to be managed together with the importance of other stakeholders. So, for instance, taxis was one issue where we could have done better, where the occupancies of taxis were full. Taxis weren't keeping their windows open. So those were some of the issues I think that our decision-making was flawed in terms of ventilation and making sure people who were travelling in congested taxis were protected.
Yeah. Are you satisfied with the information around COVID-19, the circulation of it, at least be it on social media, be it on mainstream media? As a medical practitioner, were you satisfied and, almost content that South Africans were receiving the right amount of information at the pace and urgency needed for them to make, life-saving decisions?
I think we were very lucky to have the National Institute of Communicable Diseases and the daily updates and reports from them. So in terms of science and our epidemiology, we were always up to date. So we had the right figures, we had the right time, and we also were a country that initiated genomic analysis of the SARS-CoV-2. So we also knew what variant was circulating when, and were able to let the public know, as well as the government and the world. So I think in terms of science and letting us and information, the National Institute of Health and NHLS were incredibly transparent. They found the hospitalizations on a daily basis. You could see who was in hospital, who had died, who was on oxygen, who was in ICU.
Yeah, and Prof, in the event that should there be another pandemic, is the country ready? Can we handle it better, given the lessons that you've shared with us?
I think we need a more resilient health system. So the whole health system was re-engineered to focus on COVID, and at great expense for HIV, for TB, and for cancer. We also had huge disasters like the burning of the academic hospital, which then put pressure on other hospitals. And so we need a more resilient health system. We need a more responsive health system, and we should be able to manage both a new pandemic and with iconic health systems, iconic diseases in South Africa.
Well, I appreciate your time this morning, and thank you so much, Prof, for taking this time out to reflect with us. President of the Medical Research Council, Professor Glenda Gray.